Hi, let's talk about weight loss drugs, whether or not they are really the magic bullet to losing weight quickly and effectively. So, in the interest of full disclosure, you will lose weight if you take these medications. So why doesn't everybody just rush right out and grab some? It makes it a lot easier. Okay, let's unpack why you might not want to do that and what I believe are safer alternatives. So the first thing that you have to consider is many of these drugs are actually not even FDA approved for the purpose of weight loss. Maybe they're approved for the treatment of diabetes and blood sugar dysregulation and things like that, but it's specific for weight loss. A lot of them are not. And then the other thing to consider is the US is the only place where these drugs are being used for the purpose of weight loss. Ozempic is the number one selling drug of all time, and there are some pharmaceutical companies getting super wealthy on that. So sometimes that means that their profit motive is stronger than their motive of whether or not this is really healthy for you to take this. So let's talk about some of the side effects of some of these medications. Gastrointestinal side effects. Those are you can actually slow down the transit time. You mess with digestion with these medications. So if you believe, as I do as a functional medicine practitioner, that digestion is a foundation of good health, then you think twice about whether or not you want to be disrupting a good digestive environment. So that's one thing. You can even paralyze the digestive tract. That's called gastroparesis, is the fancy word for that, and that has been related to these medications. Then you've got some certain tumors of the thyroid gland. They're called C-cell tumors. I don't think anybody wants that. And then you've got the fact that even if you lose a significant portion of weight, it's not all coming from fat. So you might think, well, whatever, it's weight loss. But if you think about a significant portion of that weight loss coming from bone and muscle wasting, then you think that's not so good, especially if you're in the population. Most of the people that I work with are somewhere in the 30s to 50s. And so they're either perimenopausal, menopausal, or postmenopausal, like that area. And why that's significant with this is because you're already losing bone density and muscle mass. Starting in your late 30s, your muscle you just start losing it unless you're fighting actively to preserve it. And then the hormonal changes right around menopause drop your estrogen, which makes bone density, it can impact the bone density. And that's why osteoporosis shows up for women after menopause. So I don't think it's worth it. I think there's enough research, and we certainly see this because this is what we do in the office all the time, is help people lose weight in a healthy, sustainable way. We think changing the diet, there are some supplements that the research rivals weight loss drugs and things like metformin and other things that the medical community is using to help with weight loss, but they're natural. They don't have the side effects. Berberine is one of them. So you can look that up, you can study that, but we use that with a lot of people, especially if their blood sugar needs to come down. Knowing how to eat, looking at using a continuous glucose monitor, and really nerding out on what your blood sugar is doing so that it stays level. Because one of the challenges with losing weight is if your blood sugar is swinging all over the place, it's just that's not great for weight loss. So doing that, and then using exercise strategically, because that counters the bone loss and the muscle wasting. So that not only are you losing weight, but you're actually losing it as fat as opposed to muscle and bone density. So when you put those things together, you just get really good success, and you build up your health instead of potentially causing some of those unwanted side effects. So sometimes if you have been doing the things right, but the needle's not moving, there's some underlying things, hormonal imbalances, thyroid problems, things like that. So we work with people to help decide, is this just a simple lifestyle, teaching them, coaching them, coming alongside them type of situation, or is this something where we need labs to help them figure out what's really going on pull up the hood, so to speak, pop the hood and see what's happening under the hood with labs and things like that. So anyway, I wanted to speak to that because a lot of people are using these drugs, and not only do they have some side effects, they have a $1,600 a month price tag. So you can do a lot of things naturally, and I think that get just as good of results as using those medications.